Welcome back to Cancer Buzz. I'm your host, Summer Johnson. On this mini episode, we begin a two-part examination of the pandemic's impact on the financial health of cancer programs across the country. The latest ACCC Trending Now in Cancer Care summary is out this week, reflecting the lived experiences of cancer care professionals during the COVID-19 pandemic. Instead of an annual survey, this year ACCC spoke directly with its members to take a temperature of the latest challenges facing cancer programs across the country. Focus group participants addressed topics like staffing, operations, telehealth and technology, research, health equity, and revenue optimization. Here today to help us unpack issues around revenue optimization is Dr. Douglas Flora. He's the Executive Medical Director of Oncology Services at St. Elizabeth Healthcare in Kentucky. Dr. Flora, let's talk about the challenges that cancer programs saw in reductions in patient volume and revenue over the last year.
Yeah, it's obviously been a challenging year for all of us, both on the patient side and the revenue side, and obviously those are intimately linked. We saw a massive decrease when COVID hit in terms of interventions on screening. So maybe 88,000 people are out there running around with cancer who aren't yet diagnosed. And that's tragic on a humanity scale because they'll present with later cancers and require more treatments later. But that also hurts places, especially small rural hospitals, that depend upon those revenue streams to stay afloat.
What about the service lines that may have seen an increase during the pandemic? Obviously, chemo and radiation therapies had to go on.
We did. We stayed open. We had some stressors because we wanted to keep our facilities clean. And so we shut down one of our oncology centers and put everyone in a different site to make sure we had one building that was COVID-free. The lack of screening for colon cancer and breast cancer hit us especially hard, and it's still not back to norm. So that does hurt healthcare systems that thrive on margins from surgeries. So we like it as doctors. I'm a cancer doctor. I really like to find cancers early because surgical regimens are likely curative and less toxic than chemo. Hospitals need surgeons to be busy and ORs to be open because those are more of the margin generating revenues that keep a wonderful cancer center able to do the nicer things too.
How are cancer programs adjusting now in 2021? Are we seeing that influx of patients, particularly with new colon and new breast cancer screenings, come in?
We're starting to, and it's encouraging and terrifying at the same time because there's this shadow curve, this pent up demand. When screening goes down 37% and our market share went up, we know that those patients are out there and they're coming. And so we've really been trying to optimize our operations and open later hours and make sure we're fully staffed for what we expect will be a heavy surge this summer. It's already starting. Our lung cancer screening program did 589 scans this month, which is our all-time record in 8 years. So we know that those people are starting to get through the wickets. That means the surgeons will be busy in 3 or 4 weeks, and then the medical oncologists and radiation oncologists 3 or 4 weeks after that, and so on.
I'd like to go back to the revenue issues from the previous year. In the pandemic, how did cancer programs adjust their approach to accounts receivable? Of course, there was some government assistance with the paycheck protection programs, but how do they adjust? And do you think that those lessons and strategies will remain going forward?
Yeah, I think we've learned a lot from this. We did have to be pretty nimble. One of the big pivots for us with government relaxing regulations on telehealth helped a ton. So we moved from maybe 250 virtual visits all of last year to maybe 250,000 post-COVID. And the government opened up a little bit in terms of allowing that to be a formal medical visit for the physician. So that afforded us the opportunity to keep people seen, but also keep them safe. From a revenue collection standpoint, we've had to be a little bit more gentle with people and recognize that there are just some dark situations out there, and you have to treat that with humanity as well. We need to keep the lights on, but we also need to recognize that cancer patients are uniquely vulnerable during times like this pandemic.
Well, to your point, I can imagine that the role of financial navigators became more critical during the pandemic.
They certainly did, and ours are active. They're running all over the floors and seeing patients and have been really heroic in getting patients support through foundations and copay assistance, free drugs. And it's been life-saving for a lot of folks who couldn't have otherwise had access to these drugs. The next step, obviously, is how do we continue those lessons that we've learned so patients continue to have access to that expertise?
It seems that some cancer programs may have been a little more prepared to the economic situation in the last year. Maybe they had service lines that were easily adaptable to the pandemic, like having in-house specialty pharmacy, that sort of thing. Would you think that that's accurate? And then moving forward, are those things that we can prepare for any sort of economic downturn going forward?
Right. Well, I was blessed that the place I work is exceptionally well. They're careful stewards of resources. So when this hit, we were in better shape than a lot of our rural hospitals and smaller community and county hospitals. And so we did have money set aside for a rainy day, and this was the rainy day. So we didn't have to lay off any staff. And it was gratifying for us as leaders to know that we were able to sort of weather that storm. We actually assumed the care of another hospital system that went under during this. So I know that not everybody was quite as fortunate. We purchased a small county hospital and we brought it into the fold to develop cancer programs there as well.
Dr. Flora, what do we do with these lessons that we have learned over the past year plus?
Well, I think we've all learned lessons that we need to plan. We need to really look at efficiencies and understand these work labor standards are actually there to protect the hospital. We look at this sometimes as leaders as onerous and, why can't I just have all the staff I want all the time and pay them whatever I wish? Well, this was one of those lessons where hospitals that were really efficient and really optimized revenue collections and appropriate billing for services rendered did better. And people who are maybe trying to figure their way out in the dark, it wasn't a great time for them. And so while we all took a hit, I think systems that were appropriately efficient before and really paid attention to things like operations and rev cycle stuff probably survived a little bit more intact and have a little bit less repair work to do on the other side.
You can find ACCC's Trending Now in Cancer Care 2020 article on the ACCC website and in the latest Oncology Issues Journal. Also, make sure to tune in next week for part 2 of Revenue Optimization. That one we'll get from the front office perspective. Until then, for the Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.